My name is Amanda Hunt, and I will be presenting our synopsis of outcomes and findings. To obtain these findings, surveys and studies were completed by healthcare workers in U.S. hospitals as well as hospitals in Ethiopia and Italy. They worked on acute care units, ICUs, and NICUs. While zero risk is impossible to achieve, the incidence of hospital-acquired infections can be greatly reduced when hand hygiene protocols and procedures are followed precisely. Findings included that nurses were more likely to practice hand hygiene upon exiting a patient's room rather than entering. This is interpreted as nurses practicing hand hygiene as a form of self-protection. The photo shown is from the World Health Organization and shows the 5 moments you should always perform hand hygiene. Only 65.6% of healthcare workers reported using the 5 essential moments of hand hygiene, according to WHO. And May 5th is World Hand Hygiene Day. Surveys showed that 74% of healthcare workers had favorable attitudes towards knowledge and practices of hand hygiene. 81.7% of nurses said that hand hygiene should always be practiced before entering a patient room. 90.4% said hand hygiene should always be practiced when exiting a patient room. 88% of healthcare workers said that hand hygiene is required even when gloves are used to touch patients. 70% of healthcare workers reported that using an alcohol-based hand sanitizer for hand hygiene is less time-consuming than hand washing with soap and water. It was proven that hand rubs significantly reduced hospital-acquired infections by 29%. Also, that having a hand washing program that is consistently applied by all nurses decreased staff infections.